Hello everyone. Today I'll be talking to you about RIRS for a lower calycial diverticular stone. The CT scan was suggestive of around 1.5 cm lower calycial stone, but diverticular suspicion was created because of the loss of parenchyma adjoining the stone. After insertion of the 9.5 into 35 cm access sheet, initial ureteroscopy, flexible ureteroscopy was done. All the calyces were visualized to find the stone. More concentration was placed for the lower calyx as the stone was located in the lower calyx. But with all our effort, we could not find any stone there, and no diverticular opening was also seen. This is the intraoperative CM picture. We show even after extensive flexion of the scope, the stone was not seen. Intraoperative CM picture was suggestive of multiple small tiny stones in the lower calyx, which further strengthened our diagnosis of a diverticular stone of lower calyx. RGP was done, which showed a small extension from the lower calyx into the diverticulum, and we can see the extreme flexion of the scope in this RGP picture. As we could not find the diverticular opening, we decided to do a blue dots test or Spritz test, in which methylene blue was injected into the pelvic calyceal system and later it was washed off with saline. And then we tried to identify the calyceal opening using efflux of the dye from the calyx. Here we can see we have instilled the methylene blue into the pelvic calyceal system, and it has washed off with the help of saline. And now we are looking back in the lower calyx. We can see a small spot of blue dye which is coming from one opening, which is clearly seen in this video, and this is what is known as blue dot sign or Spritz test, which helped us in identifying the diverticular opening. And we again reconfirmed the same with CM about the location of the stone. Once the location of the stone was confirmed both by CM and Spritz test, we decided to open this opening with the help of laser. A thulium laser was used with power of around 20 watt to cut the diverticular mouth opening. 200 micron TFL fiber was used for this case. We carefully opened the diverticular opening, and after few initial laser bursts, we could see the stone there inside the diverticulum. And once we could see some stone, the opening was further enlarged to remove the stone from the diverticulum. The stones were flushed out from the diverticulum, and once the stone came out from the cavity, they were pulverized using popcorning method. Since most of the stones were very tiny, a popcorning method to fragment the stone was used. The diverticular mouth was completely opened using laser, and intraoperative RGP was done again. Intraoperative RGP was suggestive of a diverticulum, and it was cleared of all the stone. Once the diverticular opening was made, the stones were lying in different calyx. The stones were located and were pulverized using popcorning method. 1.2 joule and 20 frequency was used to pulverize the stone using thulium fiber laser. Once the fragments were of satisfactory size and were not seen clearly on CM, a stenting was done and the procedure was concluded. So in this video we can see the importance of blue dot sign or Spritz sign, which helps in locating the diverticular opening. Thank you for watching this.